If you constantly feel like you need to clear your throat, if there's that persistent little bit of mucus sitting back there, no matter how much water you drink, no matter how many times you cough or swallow trying to get rid of it, and this has been going on for months, maybe even years, and every doctor you've asked has simply shrugged and said, it's probably just allergies or post-nasal drip. Stay with me for the next 25 minutes or so because there's a real specific and very commonly missed cause behind this that almost nobody explains properly. And once you understand it, the solution is actually far simpler than most people expect and far less expensive too. No special medication required to start making real progress on this. I'm Dr. Hale Thorne, and I've spent more than 30 years practicing medicine. And over those 3 decades, I genuinely cannot count how many times a patient has sat across from me, somewhat embarrassed, somewhat frustrated, describing exactly what I just described to you. That constant feeling of mucus sitting in the back of the throat, the need to clear it dozens of times a day, sometimes so often that people start avoiding conversations in public simply because they're tired of that little throat clearing sound, interrupting them every few sentences, worried about what other people might be thinking when they hear it happen again and again. And I'll be honest with you, I've dealt with a version of this myself over the years, so when I explain this today, I'm not speaking purely from textbooks. I'm speaking from genuine personal frustration that took me longer than I'd like to admit to actually understand and address properly in my own life, despite having access to every resource a doctor could possibly have at his disposal. Before we get into the explanation itself, I want to ask you something. Down in the comments, tell me how long you've been dealing with this, and tell me what you've already tried, whether that's allergy medication, nasal sprays, drinking more water, anything at all, even things that seem slightly silly to try at the time. I read every single comment on these videos, and it genuinely shapes what I cover going forward, so don't hold back. There's a good chance someone else reading the comments is dealing with the exact same frustration you are, and seeing that they're not alone in it matters more than people realize, sometimes more than the actual medical information itself. Let's talk about what most people get told when they bring this up to a doctor, because understanding the common, oversimplified explanation actually helps explain why so many people never get real relief. The most common answer patients hear is some version of allergies, or post-nasal drip, or simply, that's just what happens as you get older. A phrase that frankly gets used as a catch-all explanation for far too many symptoms in medicine, often closing the door on further investigation when a more specific answer was actually available all along. And look, those explanations aren't entirely wrong. Allergies are real. Post-nasal drip is a real phenomenon. And yes, certain changes do happen to the mucous membranes as we age. But here's the problem with stopping the explanation there. It treats this as one single generic issue, when in reality, there's frequently a much more specific underlying cause sitting underneath all of it, one that allergy medication and nasal spray simply aren't designed to address at all, which is exactly why so many people try those things faithfully for months, sometimes years, following every instruction precisely, and see little to no real improvement, leaving them feeling like they're simply broken, in some way nobody can quite explain. The real cause I want to walk you through today is something called laryngopharyngeal reflux, sometimes shortened to LPR by doctors, and it is fundamentally different from the heartburn most people associate with the word reflux. With typical acid reflux, what most people call heartburn, stomach acid travels up into the esophagus and causes that familiar burning sensation in the chest, something most people would immediately recognize and connect to what they ate, the kind of sensation that sends most of us reaching for an antacid almost reflexively. LPR is different, and that difference is exactly why it goes undiagnosed so often. With LPR, small amounts of stomach acid, sometimes even just stomach enzymes without much acid at all, travel all the way up past the esophagus and reach the throat and the back of the nasal passages, the larynx and pharynx specifically, areas with far more sensitive, far more delicate tissue than the esophagus. Tissue that wasn't designed to handle any acid exposure whatsoever. Even in small amounts, even just a handful of times a week, the result isn't burning, it's irritation, and your body's natural response to that irritation, almost exactly the same way your eyes water when something irritates them, is to produce extra mucus, as a kind of protective coating over that irritated tissue, an attempt by your body to soothe and shield something that's being repeatedly exposed to something it was never built to tolerate, night after night, often while you're sound asleep and completely unaware it's even happening. This is why so many people with LPR have absolutely no idea reflux is even involved, because they've never once experienced classic heartburn, not even mild heartburn, And so when a doctor asks the standard question, any heartburn, any burning in your chest, the honest answer is no, and reflux gets crossed off the list far too quickly, when in reality, the silent version of reflux that affects the throat specifically doesn't need to produce any chest burning at all, to be very much present and very much the actual underlying cause of that constant mucus sensation. Why does this become so much more common after 50 specifically? There are a few real physiological reasons. The muscle at the top of your stomach, the lower esophageal sphincter, which is supposed to act like a one-way valve keeping stomach contents where they belong, naturally loses some of its tone and strength as we age, the same way muscles throughout the rest of the body do. A gradual loosening that happens slowly enough that nobody ever notices the exact moment it starts. On top of that, many of the medications people commonly take more often after 50, certain blood pressure medications, calcium channel blockers specifically, certain medications for anxiety or sleep, even some common pain relievers taken regularly for arthritis or back pain, can further relax that same muscle as something of a side effect, which most patients have absolutely no idea about. Since nobody ever connects that conversation to a constant throat-clearing complaint sitting in a completely different part of the body, two issues that, on paper, look like they belong to entirely separate specialists. Let me tell you about a patient of mine, a man named Frank, 68 years old, a retired high school football coach who'd spent decades barking instructions across a field and prided himself on a voice that could carry from one end of the bleachers to the other, the kind of voice his former players still recognized instantly even years after graduating. Frank came to me incredibly frustrated. He'd been to 2 other doctors before me, tried 3 different allergy medications, a steroid nasal spray, even cut dairy out of his diet entirely, on the advice of a well-meaning neighbor who swore it had solved her own similar issue, and nothing had made a meaningful difference in 18 months of constant throat clearing, something that had genuinely started affecting how confident he felt during the weekly poker game he hosted with old coaching buddies. When I asked him about his evening routine, it turned out Frank ate dinner fairly late, often closer to 8 in the evening because of how his retirement schedule had shifted, no longer bound by the early dinners his coaching schedule used to demand, and then settled into his recliner to watch sports until well past 11, frequently dozing off right there in the chair before eventually making his way to bed. That late meal, combined with lying down or reclining not long afterward, is essentially a textbook setup for exactly the kind of silent reflux we're talking about. Gravity simply isn't helping keep anything down where it belongs once you're horizontal or even significantly reclined. We made some specific changes, eating dinner earlier, staying upright for at least 3 hours afterward, elevating the head of his bed slightly, and within about 6 weeks, Frank told me, with genuine disbelief in his voice, that he'd gone an entire day without clearing his throat more than once or twice, something that hadn't happened in over a year and a half, and that his poker buddies had even noticed and asked what had changed. Now, a quick pause here, because if you've made it this far into the video, you're clearly someone who's been genuinely frustrated by this, and is looking for a real answer rather than another generic suggestion. The kind of answer you've maybe been hunting for across more than one waiting room, so go ahead and tap that like button if this is resonating with you so far. It genuinely helps this information reach more people dealing with exactly the same frustration. And let me know down in the comments, does any of what I just described about evening eating habits and reclining sound familiar to your own routine? I read every single comment every time, and these specific details people share often help me understand patterns I bring into future videos. Let me walk you through the practical changes that tend to make the biggest difference, because understanding the cause means very little without knowing what to actually do about it. First, timing of meals matters enormously. Try to finish eating at least 3 hours before lying down, or even significantly reclining, which for most people means shifting dinner earlier, rather than eating right before settling in for an evening of television, even if that means adjusting a routine you've followed for years simply out of habit rather than any real planning. Second, elevating the head of your bed. Not just stacking extra pillows under your head, which can actually bend your neck in a way that makes things worse and sometimes creates its own discomfort entirely, but genuinely raising the entire head of the bed frame several inches using risers under the bed legs or a wedge under the mattress itself uses gravity properly to help keep stomach contents where they belong throughout the night, working with your body's own physics rather than fighting against it with a stack of pillows that tends to slide apart by 2 in the morning anyway. Third, certain foods and drinks are more likely to relax that same valve muscle we talked about earlier. Things like caffeine, alcohol, chocolate, peppermint, and very fatty or fried meals. And while I'm not telling you to eliminate everything you enjoy, life is too short for that kind of restriction over something manageable. Paying attention to whether symptoms worsen on days you've had more of these particular things is genuinely useful information worth tracking. The same way Frank eventually noticed his own symptoms flared noticeably worse after his weekly poker night, which, not coincidentally, always involved a couple of beers and a late-night snack spread laid out on the table. I also want to mention something about hydration that connects directly to this whole picture. A lot of my patients trying to manage that mucus sensation end up drinking enormous amounts of water throughout the day, specifically trying to wash the feeling away, carrying a water bottle everywhere, taking constant small sips even when they're not particularly thirsty, which seems logical on the surface but often doesn't address the underlying irritation at all, since the mucus is your body's protective response to ongoing irritation, not simply something that needs rinsing away like residue stuck to a dish. Staying reasonably hydrated matters for your overall health, certainly. That part hasn't changed, but it's not the actual fix here if LPR is truly the underlying cause, which is exactly why so many people drink water faithfully all day long, sometimes well past what their thirst actually demands, and still feel that same persistent sensation by evening, growing more and more discouraged that something so seemingly simple as drinking enough water isn't solving a problem that feels like it should respond to something that basic. I think it's worth mentioning something about how this connects to voice changes too, something a lot of my patients don't initially think to mention because it seems unrelated, an entirely separate complaint that nobody thinks to connect back to the throat clearing they came in to discuss in the first place. That same irritation from silent reflux affecting the vocal cords specifically can cause a slightly raspier voice, particularly noticeable first thing in the morning, before that first cup of coffee or that first real conversation of the day, or a voice that tires more easily than it used to over the course of a long conversation or a phone call with the grandkids, fading by the end of a call in a way it never used to years earlier. If you've noticed your own voice isn't quite what it used to be, especially earlier in the day, that's actually a meaningful piece of supporting evidence pointing toward exactly this same underlying cause. One more piece of the puzzle that, on its own, might seem unrelated, easy to dismiss as simply getting older or needing more coffee, but taken together with the throat clearing, starts painting a much clearer picture of what's actually been happening underneath the surface. I want to be honest with you about something important here. Not everyone with chronic mucus and throat clearing has LPR. There are other genuine causes too, true allergies, chronic sinus issues, certain thyroid conditions, even simply the natural thinning of mucous membranes that does happen somewhat with age regardless of reflux. And I don't want anyone watching this to assume LPR is automatically the answer for them without considering the full picture of their own situation. What I'm sharing with you today is the cause that, in my 30 years of experience, gets missed most often, the one that frequently sits underneath a frustrating cycle of trying allergy medication after allergy medication without ever actually getting to the bottom of things. The cause that, in my own clinical experience, explains far more cases than most patients, and frankly many doctors working through a packed schedule initially consider. If you've tried the standard allergy route already without real success, genuinely tried it, given it a fair shot over weeks or months rather than just a few days, this is exactly the conversation worth having directly with your doctor, specifically asking, could this be silent reflux affecting my throat rather than continuing down the same path that hasn't worked so far, simply because it was the first explanation offered. I also want to address something I hear often, which is patients telling me they've already had an endoscopy or other testing that came back essentially normal, and assuming that rules reflux out entirely, often arriving at my office somewhat exasperated, having already done what seemed like the thorough, responsible thing only to be told everything looked fine. Here's the nuance worth understanding. LPR can be present even when standard testing for typical acid reflux looks completely unremarkable, because the amount of reflux causing throat irritation can be quite small, far smaller than what would show up as visible damage on a standard esophageal exam, looking specifically for the kind of damage typical heartburn causes lower down, in a part of the body that simply isn't the focus of that particular type of testing in the first place. This is exactly why bringing up the specific symptom pattern, the constant throat clearing without classic heartburn, matters so much in that conversation with your doctor, since it may point toward a different kind of evaluation entirely than the one already completed, sometimes involving an ear, nose, and throat specialist, rather than the gastroenterologist most people assume is the only relevant referral for anything reflux related. So here's what I want you to take away from today. If you've been dealing with this constant throat clearing sensation for months or years, and the standard allergy explanation hasn't actually solved anything despite genuinely trying, consider that silent reflux affecting your throat specifically might be the real underlying cause sitting beneath it all, the explanation nobody got around to offering you yet. Try the practical changes we talked about: earlier dinners, an elevated head of bed, paying attention to those specific trigger foods, for several consistent weeks, giving it genuine time to show a real result rather than judging it after just a few days. And bring this specific possibility directly to your doctor if you haven't already, using the actual term laryngopharyngeal reflux. So the conversation starts in exactly the right direction from the very first sentence, rather than circling back to the same allergy conversation you've already had more times than you'd care to count. Before you go, think of someone in your life who's mentioned this same frustrating throat clearing habit, maybe without ever realizing there might be a real specific explanation behind it: a spouse who clears their throat through every dinner conversation, a friend who's mentioned it in passing more than once, and send them this video. Sometimes the most valuable thing we can give someone we care about is simply the right question to finally ask their own doctor, the kind of specific question that can save months, sometimes years, of trial and error with explanations that were never quite right to begin with. And if you want to know the one simple test you can actually do at home tonight to get a better sense of whether reflux might be playing a role in your own symptoms, that's exactly what I'm covering in the next video, so don't miss it. This video is intended for general educational information based on clinical experience and published research, and it is not a substitute for an actual conversation with your own doctor, who can properly evaluate your specific symptoms and history far better than I ever could from all the way over here, through a screen, without ever having examined you directly. Take good care of yourselves, and I will see you in the next one.